Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. The topic is cervical cancer controversy solution. Yes, there is this controversy, especially for children age 15 and below, female, girls, being vaccinated when it is probably morally wrong. The virus that causes this infection is known to be transmitted by sexual means. And the reason for all this vaccination, what you want to give them is that vaccine that will act on that virus, which is sexually transmitted. And you now wonder, are you telling the girls to be promiscuous? Are you saying that those who probably want to stay morally right until marriage should be discouraged by doing these preventive measures of vaccination? And the other implications of vaccination, these are the controversies that one keeps hearing. The WHO in itself, in its recommendation, has discovered that even those who have these viruses, some people do overcome. They really overcome the infection and they are okay again. And that's those who really do not overcome this infection are those who probably are HIV positive ladies, immunosuppressed ladies, or people who have other co-infections and so many other factors which I shall expose as this as we progress into the slide session. That controversy is really genuine. Nobody wants to vaccinate a girl because you believe that she is later going to have the infection, when those who even have that infection, if they stay according to prescription, they overcome. Even those who are not even treated for it, it has been discovered that some do remit out of it, that they become free of this virus, the human papilloma virus. Having said that, there are issues. That is, when we are talking of solution, how do we prescribe the solution? What do we do? Because there are people who are still coming down with this infection, with this cancer, and it's starting usually from age 18 or 25 up to over 60. But those early stages are people who are very promiscuous. You find it so. But can anybody vouch for anybody in these days where people, even children, are abused? Majority of some of these children that are abused have this develop this cancer later on. So it is a serious problem, controversy that one can easily resolve by understanding the etiology agent, the human papilloma virus, and also the efforts that has been made in prevention, as well as how you can screen to effectively know, since we have been able to link the cervical cancer to human papilloma virus, which one can easily detect in the laboratory using gene sequencing and other advanced method that can be used. The pap smear too could also be used, which has been in existence for long. But these are all invasive method that you have to invade the vagina up to the cervix to collect the epithelial cells of those regions. So the full detailed things one has to do as preventive is what I shall bring on this, I shall expose on the slide session. So stay on and let's see how we gather more knowledge and also the solution to this cervical cancer problem. the early detection has always been the only way out for many cancer diseases. But when you are waiting for the symptoms, especially the bleeding, then the problem has already started. But before it starts, that's part of the solution. Let's progress into the slide session, but don't forget to subscribe and press the like button. The outline, objective, introduction, cause of controversy, prevention, lab diagnosis, and conclusions are all that I shall be speaking on in this section. The objective: to expose the cause of the controversy in the etiology of cervical cancer, the imperative of administering vaccine to young virgins, the continuous need for screening the squamous epithelial cells of the cervix of sexually active women, and the role of the medical laboratory scientists. The introduction. Cervical cancer has been found to be caused by human papilloma virus, a sexually transmitted virus. And the controversy of this statement is because there are over 200 types of HPV found in people, and only the HPV type 16 and type 18 are considered high risk oncogenes type, because the 15 others some 15 others are considered low risk oncogenes. They could cause warts, cause other infection, even penile cancer. Nearly all cases of cervical cancers are due to chronic HPV infection. That's the finding of one person, and that is instructive. That is, if you don't treat it, which means you have to continually test that whether you have the presence of this HPV, especially the high risk one. It also causes penile cancer in gay, that is, those who encourage homosexuality, men. HPV is a member of the Papoviridae family. It is a relatively small non-enveloped virus of about 55 nanometer diameter. It has an icosahedral capsid with 72 capsomia, and these contain at least 2 capsid protein L1, L2. The HPV genome consists of a single molecules of double-stranded circular DNA. That's over 97. The cause of controversy. According to WHO, HPV is the name of a group of 200 known viruses. That is not all of them causing the problem. So that's controversy. Very important controversy number one. And out of these 200, probably you can barely count 15. And out of these 15, only 2 types of this HPV really are high-risk oncogenes. That is when you see them in the vaginal region, because they continue to appear so long as the person is sexually active, which means it's transmitted by a male to the female. The male are also affected, especially those who are gay, practicing homosexual cause. Then there's this other problem again, that you have to vaccinate between 13 and 15 when the child is not yet exposed to sex, so that you can prevent the HPV from even coming up in the child at all, from the child experiencing the high risk oncogenes that could result in cancer of the cervix. Then 2, in 90% of people, the body controls the infection by itself. Even with the high risk, the body controls it. Persistent HPV infection with high risk type is the cause of cervical cancer. You can hear the word persistent, that is, it continues even after treatment, and it's associated with cancer of the vulva, vagina, mouth, throat, penis, and anus. Then 3, the risk factors shown in the image display, starting with early marriage, and then younger people who have reached the puberty having that great urge for sex, they start having sex, and if they are now very promiscuous, they tend to have it. It's like a sure belt. And if they are not doing proper hygiene of their genitalia, the genital is another problem, and they start getting involved in smoking. Smoking even reduce the immunity of the body. You still have multiple pregnancy as a risk factor, and these are all things that are very common with even other diseases. So it becomes controversial when you want to pin it on the causing cervical cancer. So the virus itself is another, and then the contraceptives. Once there is pregnancy, the contraceptive is also contraindicated because the study has shown that. But all these are not things that you can 100% say that because you smoke, then you must have it, or because you are not, you marry early, or you gave birth to so many children. Even at a stage, it was a kind of problem. I mean, understanding that even if you give birth to many children, you could even be saved. But now it is contraindicated. Yeah, we must also look at number 4. The HPV infection take a long time to develop into cancer, and so a positive test may be inconclusive, or the pap smear result says it is atypical squamous cell of undetermined significance, creating anxiety for some because it takes a longer period for that infection. You have it, they found it, but yet the infection, the cancer has not started. The onset of the cancer has not really started. Nobody can confirm that yet. Yeah, you can peruse more of the research findings. It's the commonest cause of sexually transmitted disease. Its transmission does not require penetrative sex, even the skin to skin. If you think using condom will prevent, that has been proven that once it touches the skin, it can spread. The peak period for acquiring HPV is shortly after becoming sexually active, and cervical cancer is the 4th most common cancer in women worldwide. And in 2018, in developing countries, cervical cancer may constituted 25% of all female cancer deaths, and is only preceded by breast cancer worldwide. Yeah, the solution to this scourge, screening is very important. And that has been what has been approved, where you do pap smear. But now, the opportunity of doing both the HPV testing for that virus itself, and detecting it early stage cervical cancer at a time when treatment has a high potential for cure, is the most important solution, even for many cancers. Currently, primary approach to HPV prevention include both risk reduction and the development of vaccines against HPV infection. Furthermore, the risk of contracting HPV may also be decreased with the use of latest condom and spermicide. But however, these are not totally reliable, since HPV infection may be transmitted through contact with other parts of the body, such as the external genitalia or anus, that are not protected by the condom. The laboratory diagnosis. The test that will be done is usually the HPV assay, where you test directly for the virus for primary screening. It could be DNA-based test, where many assays detect the DNA from the L1 gene, which is a common approach to identify HPV. Then you can also do the RNA test. Other assays like this also help directly related to the virus ability to cause cancer. That's where the mRNA test is. Then there's complementary to pap smear test. Others. Finally, the conclusion. The incidence of cervical cancer and its associated mortality have declined in recent years, largely due to the widespread implementation of screening program. The screening program has so many benefits. You could screen and then find the high-risk oncogene present, that is 16 and 18. That does not translate to mean that you have the cervical cancer, the cancer has started. No, but it now has to be monitored and treated. The pap smear is also very useful to combine it and use that to monitor if there is any injury, that is aggravation of these cells multiplying uncontrollably. That's cancerous. So the beginning, and that's when it is necessary to now intervene with all kinds of treatment intervention. The screening strategy monitor ASCO those who are also negative, especially if they are immunosuppressed women. They are directly viewed to see whether the cells have started, the malignant cells have started growing. Other recommended preventive intervention against HPV infection that are appropriate for both boys and girls are education about safe sex practice, including delay onset of sexual activity, male circumcision, and warnings about tobacco smoking. The WHO recommends vaccination for girls aged between 9 and 13 years, as this is the most cost-effective public health measure against cervical cancer. If you like my presentation as usual, click the like button and also subscribe. There are so many videos for you to watch. It's over close to 200 right now, over 189 if I could guess.